Good morning. So I know most of you and have met most of you, and there's only a couple, but my name is Courtney Kaufman. Uh, Congratulations, you made it. You found our online links, and you found where you were supposed to click, and you made it to our online virtual meeting. So good work. We are going to go ahead and get started. I wanted to welcome you this morning to our once a month Catalyst meeting in Modesto for influencers, and really, you all have influence no matter where you're at. So we just wanted to thank you for joining us. And if you're joining us on Facebook Live, we encourage you to interact, comment, ask your questions, and do what you do on Zoom. I want to take a minute and introduce our speaker, Dr. Bernardo Mora. So he has been the medical director for Stanislaus County Behavioral Health and Recovery Services since January 2018. Before becoming the medical director, he was a child psychiatrist for BHRS beginning in 2005, November of 2005. He was born and raised in New York and did most of his education and training there. In 1993, he moved to California to do his child psychiatry and forensic psychiatry fellowships, and he attends Grace Church in Modesto and serves as a trustee there. For one quick fun fact, he runs a radio station in his spare time, Grace Radio FM 107.9. So please welcome with me Dr. Bernardo Mora as he shares about mental health in the current climate of 2020.
Thanks, everyone. Yeah, so this is a little bit of a, as you might say professionally, a boundary crossing for me. Some of you may recognize me from past Catalyst meetings where I have attended, but not as the medical director or a child psychiatrist, but from Grace Church, passing out my flyers or our flyers, and just making people aware that we have the tiniest little radio station in the world. So this is a little different, but I'm happy to be here and honored to be here, and I thank you for the opportunity. So yeah, behavioral health in Stanislaus, and thank you again, Courtney, for the introduction. I still do see a few child and families in my clinic. It's much less than I used to, but that's where we'll go. So I'm going to try to fly through these slides fairly quickly. The information is there, and if you have questions about it, you can certainly ask me now, or reach me even after the presentation. But I really wanted to give you kind of an overall, mostly a big picture view, and then just leave enough time for questions and answers. I have a sort of a hard stop at 8 a.m. only because I have to take my kids to their learning pod, so they're not too late for school. But I will stay on as long as I can after this. So, so this may be one of the few meetings where I can actually get away. I have done it once before in context, but I can actually present you some scripture. And this is my reminder to say at the outset, very big picture, that what I do in my office, which is narrowly speaking, but not always this narrow, worry about prescribing medications and diagnosis and such like that. And then my colleagues, of course, who do all kinds of counseling and social interventions and family interventions. Those are all important, and those can be helpful. But there is a bigger picture at hand, and there is also much needed, and I dare say sometimes much more important supports. Even in our breakout group, we talked a little bit about worldviews and friends and social supports and such like that. I'm sure some of you did in your breakout groups as well. So I'm just going to leave you. This is not going to be a sermon because I'm not qualified to do so. You can ask your pastors or other faith leaders about these verses. But I'll start with two verses, one of which is nobody's favorite. It's Isaiah 45:7. I am the one who forms light and creates darkness, the one who brings about peace and creates calamity. I am the Lord who accomplishes all these things. So the classic, contrast, even in just one verse, just points to the greatness and the majesty and the awesomeness of our God. And then the very famous, which is some of our favorite verses, some of us have favorite verses, which I think I've heard in about 3 different contexts, 3 different sermons and 3 different speakers' services, even in the last 2 months. It's the passage from Matthew 6. Therefore, I tell you, do not worry about your life, what you will eat or drink, or about your body, what you will wear. So there's a gentle admonishment about succumbing to too much anxiety or worry. So again, just some big picture things and things to meditate upon for later. So some of you may have seen this news report, which actually came out in May. It was a TV news report, I think on San Francisco station, and it went nationwide, I think, because this was still not early in the pandemic, but from the end of May. And the assertion was that suicides were on the rise amid the stay-at-home order. So my biased take on this is there was one ER doctor and one ER nurse that went on the record to basically say at our hospital, which was John Muir in Walnut Creek, that they saw, quote, a year's worth of suicide attempts in 4 weeks, close quotes. And therefore the doctor was advocating for an immediate end to shelter in place, which was the state order at that time. There was no further data or follow-up to that story that I could find, certainly on that website or doing searches or anything else. And some collateral data that came out after that, in conjunction with that story, was just a survey, a quick little indicator that hotline calls had increased that week, but not dramatically, according to Contra Costa County. So again, one of the big picture things that we are fighting across a lot of fronts is either information overload or misinformation. I am not trying to characterize these medical professionals as having an invalid or false experience or anything like that, but it always has to be put in context. So sometimes sensational stories, it's a little sensational in my view. It doesn't mean it didn't happen the way they said it happened, but it always depends on the context and how it gets out. A more little sobering study, which actually just came out last month, because we are in September, was the CDC study. Was reported in the B and also widely. And this I'm going to spend a little bit more time on, just to give you the context. So this was the results of a survey that the CDC conducted. And actually, there were anywhere from 2,000 to 6,000 adults that responded to some part of this survey. And basically it was trying to figure out, what people's symptoms were. That's the basic idea of it. It's not a controlled study, but it's analysis of a survey. And so, having 2,000 to 6,000 adults give their survey feedback and have data, could be significant. And basically the survey found that symptoms of anxiety and depression were increased 3 to 4 times, although being a little picky and putting on my scientific hat, they're comparing them to different surveys from a year ago. So again, someone could point out that it's getting a little further away from what someone might consider even a controlled study, or using the same survey that you did a year ago to the one that you did just now in this year to try to figure out what the changes were during the pandemic. Still, the survey did find that there was some increase or start of substance use because of the pandemic that people attributed to the pandemic. And much like the last brief report that I gave you, that there was some indication of suicidal ideation that was elevated. Because of the numbers they had, they were able to break out certain subgroups in the population: younger adults, minorities, essential workers, unpaid caregivers, and declared that these groups were a little more affected than the average in the survey. So again, there's a few limitations here. It's information, it's a point in time. But they used symptom surveys, which is fine. They used self-report. Again, it's a survey, so they didn't back it up with any more objective testing. Some true double-blind studies and other things would actually have you do a survey, and then they would actually test you, which of course is a lot more involved, and you can't do remotely. But they would test to see, oh, look, I didn't use any substances, and then they'll test you, and then they'll compare the results and give you more data that way. So the following week, in the New York Times opinion pages, there was an interesting I wouldn't say a total contrast, but a little bit of a balance by a psychiatrist who writes opinions occasionally for the New York Times, Dr. Friedman. And the headline basically says it is the lockdown making you depressed, or are you just bored? And this kind of came up, interestingly, even in our breakout group, that, you know, one of the ways to cope is really to try to keep busy, because if we stop being busy, sometimes we can't live with ourselves. And I'm not being hyperbolic just for the sake of hyperbolic. That's basically, in a nutshell, what Dr. Friedman says. So along the lines of, like, for example, well, what do you do with the survey or the news reports that I just said, that I just mentioned to you about? He very clearly says, you know, we don't know whether surveys will mean there will be an epidemic of behavioral health conditions, mental health conditions. That requires follow-up studies. You know, it's just a general principle of science. You know, unless one study really has a big effect or no effect or shows you some terrible side effect that you need to avoid, you typically don't want to rely on just one study. And that, of course, is the difficulty with having a novel coronavirus pandemic, is that everybody's learning on the fly. So the studies are coming out and it's one at a time or a couple at a time. But really the aggregate wisdom, you know, in the scientific community is from multiple studies, repeated and validated, and that takes time to do. I've heard people complain, well, the science keeps changing. That's because the science isn't settled, and sometimes it doesn't get settled for a long time. So you just have to do the best you can with the information that you have. So Dr. Friedman continues, he says, boredom is a normal state. It basically means that you would like to have enjoyment, but there's something that's keeping you from the enjoyment, whether it's external, like being locked down at home, or internal, like, well, I feel sick and I can't go outside. I can't enjoy the outdoors and things like that. Someone mentioned having routine as a help through times like these. And of course, quarantine and isolation orders and closures of our favorite places to go, whether it's to eat out or to shop or just to have a diversion occasionally, those have all interrupted all of our routines. And so, you know, sometimes people get restless, like, really, I'm just supposed to watch TV again, or I'm just supposed to eat the same thing for dinner because I can't go to my favorite restaurant. So that's kind of where, you know, that fits in. He cited a study where people literally were asked just to sit in a room by themselves and just think. And oh, by the way, if you get bored, there's a little button here, you can press it and you can give yourself a little electric shock. So more than half the people, after 15 minutes of sitting in a quiet room with nothing else to do but sit with their own thoughts, decided that they were going to shock themselves. So that's how badly sometimes we want to avoid being bored or feel like there's nothing to do. And it may be our society now is so used to being stimulated all the time. You know, I'm old enough, again, dating myself, you know, I don't wear earbuds all the time with music constantly in my ears. That's personal preference. I'm not making a judgment on anyone that does, but it's just not what I usually do. I have it in my car, but not if I'm not in my car or doing other things. But, you know, there's just an increase in stimulation. And if that stimulation is gone, sometimes people feel like they have nothing to do or they're not being stimulated enough. So Dr. Friedman actually encourages folks to reflect and to use time that maybe we have, you know, sort of found time and not, you know, not to be bored about things, but to reflect on things like, are we spending our lives meaningfully? Is what we are doing rewarding? Or what things might we change to make life and ourselves more interesting? And I put interesting in quotes because frankly, that could mean a lot of different things to a lot of different people. Of course, for this group and for others, I would say this is the time to draw closer to God and not necessarily further, because that can be certainly a help and to prevent that feeling of being bored. So back to some general comments about what we've seen, fallout from the pandemic, and some of these you know and I've alluded to already, increase in substance use, changes of natural supports, school, daycare, changes in work routines. Those who are considered so-called non-essential workers basically may have just had to stop working, through no fault of their own. And then in terms of healthcare, there have been inequalities in healthcare, but they tended to have come into a little bit sharper focus, and that those disparities, because of the lack of access and the changes, have become a little bit wider and a little bit more pronounced. So that's a healthcare impact. I don't have to tell you, because it's been all over the news if you're still watching the news, impacts on nursing homes and what's also called congregate care, which means anyone that lives together, not necessarily blood related, but group homes, skilled nursing facilities. There are specialized mental health facilities for such. So there's been an impact for those folks. And then just a general increase in isolation and its impact on grief and loss, which for many folks, no matter what your tradition is, the way that people grieve over loss of someone or something, in case of an animal they care about, has changed because they may not be able to do what they normally do. You can see many of the stories about, well, I could not be with my loved one in the hospital because I wasn't allowed to be, because the hospital didn't have visitors, wasn't allowing visitors. And that's a big impact on folks, because that's a sensitive time in people's lives. So we have experience from other epidemics. I remind myself and others, although I'm tired, frankly, also of using the phrase, this is an extraordinary time in our history, but it is true. Pandemics like this only come around once a century. So it's even rarer than once in a lifetime. Once in 2 or 3 lifetimes, perhaps. But we can study and glean from, similar epidemics or past, dare I say, call them disasters. It's a slow-growing, long-acting disaster, in my view, that we can try to figure out and predict what may happen or what we need to, look out for. And specifically for COVID, in this study that was published in June, that there have been people that do high-risk behaviors, ignoring physical distancing, which, just a little plug, frankly, I prefer the term physical distancing rather than social distancing, because you can use technology, just as we're doing right now with Zoom, to be socially close, or close as we can be, without, with being physically distant. So I use physical distancing. But if you ignore that or ignore travel recommendations and isolation recommendations, it will tend to accelerate the disease spread and make it more difficult to isolate confirmed cases. And also, extreme avoidance of social contact may result in increased risk of behavioral health issues. And that will be no surprise to anybody on this call. So how do you reduce risk and promote resilience? Well, you basically have to do what's called, in our lingo, psychoeducation. That's really just a fancy term for, well, we need to, help you to understand that, what you're doing, what you're feeling, 1, may be normal, and or 2, is not healthy, and here's why. And also, if someone has, really an extreme fear-based or anxiety-based response, that to try to channel that into something else, rather than just say, well, I can't go out of my house, so I'm just going to stay at home and do nothing. That would be a little bit of an extreme response if carried to its logical conclusion. So here's a slide, and I think I'll have another slide later too, just to show sort of the possible time course and where we are at. This is actually from the state of Washington, who did a very nice job, and I thank Dr. Vaishampayan, our public health officer, for sending this my way recently. It's meant to be a chart, and I'm not going to read through the details, but you can kind of see where, at least in past pandemics and disasters, that there are phases of reactions, and some of the phrases and terminology will be familiar to you. We've already passed the honeymoon phase, and it seems like we are in that kind of phase of disillusionment. It's been a bunch of months, post the outbreak and in the pandemic, and people are starting to, have less helpful, and more more reactions that are not helpful. And so there's and different things, and people will become more sensitive to different things. So it's sort of like a time course, and people keep talking about the new normal. Well, that's sort of the right side of that graph, which is reconstruction, where folks will eventually find basically the same sort of functioning they were before. It may not look the same and it may not feel the same, but it will get better, as folks will say. So some more, I alluded to this at the very beginning, because it is an unprecedented outbreak. I mentioned that misinformation or inaccurate information is a huge issue. And so, some of the ways to combat it, I've listed for you there. And it's basically, instead of spreading information, and people do this innocently, right? It's just so easy now on social media. You see a story and you react one way to another, and you just click it, and then it gets shared with everybody or everybody on that social media platform. And that may not be the best use of things, because unless you have really critically thought about what you're sending, it may not be best, maybe, for the folks that you're sending it to, or just to keep propagating things that may turn out to be inaccurate in the long run. So the good use of social media is to be social, to enhance social support and connectedness. So contact with friends, caregivers, relatives, casual contacts, things like that. It has been shown during this pandemic that there's been a little bit less just healthcare in general, both physical as well as behavioral healthcare. So if that is something that somebody needs, that they should continue with that. And just because that's another piece of keeping up people's health. And then this one study paper back from June in the Journal of American Medical Association of Psychiatry was advocating for the large social media platforms to basically manage those news feeds. And I know some of the social media platforms are doing this, trying to vet whether the news is accurate or not, or direct people to credible sources of information. And someone in my breakout group, again, thank you, made my job easier. Limit media exposure time. So from a practical grassroots, if you remember nothing else from my talk, if you're using media, consuming media, all forms of news, social media, whatever, and it's significant, whatever that means, cut it in half. And then sort of like when you pack for a long trip, cut it in half again. Some of us have to monitor it because it's part of what we do and part of our job. But there really is, there is a cause and effect, not a direct one, I would say, but, watching, consuming, too much misinformation, even inadvertently, or negative news, whatever that means to you, is not healthy. So limit your media exposure time. So again, a different way of looking at, what behavioral health symptoms might happen or could happen. And again, for Washington State, came from the same paper, the same briefing. We're kind of in that middle phase between 6 and 9 months, where because of sort of the chronic lack of access to resources, there may be concerns about, whether there's enough eyes on folks to help prevent suicide and victims of intimate partner violence and child abuse and such like that. And then, just progression into potentially, not definitively, but potentially higher rates of depression and post-traumatic stress disorder. The flip side of this, of course, is that there is such a thing as called resilience, which is not, this is not a forecast for everybody in the population that would automatically experience things. There is a very normal experience of, negative emotions, sadness, and dysphoria, anxiety, too much. But the flip side is there is such a thing called resilience. So when stress levels are high, and this came from one of our county leadership summits just this past month, these are the things that you can do, that anybody can really try to do. To seek to understand and remain focused on what's truly important. So get rid of the fluff, pare it down to what's really important, keep it simple, realize our limitations, let go of what isn't critical. We all wish we could do more and accomplish more, but when we may not be able to because of stress or trials or such, you have to make priorities and choose. And sometimes it means saying no to things, but you focus on the critical things. And then self-care and self-regulation, these will mean different things to different folks. So I may not get into too much specifics except what I'll get into here, but it really is take care of yourself. Know what works for you, try to figure out what works for you. Regular sleep, comfort foods even, consult with your doctor, but comfort foods, walks when it's possible to do so. Get back to some of those habits that you can still do even with all the chaos and mishigas going around us. Get back to those, and that will help your overall outlook. Stress can lead to growth. See, either I cheated from Mike or Mike cheated from me. I don't know which one. But it can lead to growth. It's not necessarily leading to anxiety and depression. It's a matter of how to increase resilience, if you will, or to take advantage of that resilience, to find those strengths even that you didn't know that you had, or, wow, I haven't done that in a long time. Those are all positive things. Maintain a positive outlook, hope, possibility, joy, and happiness. These have been shown and proven to help people bounce back from adversity, to help you bounce back from adversity, and even to increase immunity from illness. Folks smarter than me actually did go in and did what I suggested before with double-blind studies. They didn't just ask people, gee, do you feel more immune from colds and flus? They took blood samples and measured T cells and white cells and all that. And they tried to correlate it and were successful in doing so to folks that did some self-report that said, generally speaking, I'm okay, or generally speaking, I can feel joy. So, and all of these things can help to being more agile, not just with our emotions, but with coping with stress and with our well-being. So specifically, and more specifically, what could you do? What can I do? And particularly for this group, I will remind this group to pray. I need the reminder daily, even though it should be a habit, but it needs to get more of a habit than it is. Pray regularly, become or remain excellent in your particular ministry, work, outreach, whatever it is that you're doing. Presumably, if you're doing it, it's important to you. So, stay focused and excellent on doing that, and remain open, as I said, that builds resilience and builds, builds character, I think. If you're led to do so, to branch out from whatever you're doing, and it means taking up something new or related, or, again, to, the process of growth sometimes leads us in directions that we don't expect to go. And I dare say that that's a universal kind of experience. Okay, let's see. This is the time for questions, if there are any. I'm going to try minimizing this, or actually, I think what I need to do is stop sharing and see if anybody has any questions or anything.
If there are any questions real quick, why don't we have people share them in the chat, and then we can, we'll real quick run through those.
Tony's asked, will the slides be shared out? Sure. I will figure out how to get them maybe in a slightly nicer format. That's a tech thing in my brain, but I'll figure out a way.
So this is what I would say. If you want a copy of the slides, go ahead and email me at mike@cityministrynetwork.org, and I'll make sure that those get to you from Dr. Mora.
Mike, I got distracted. So should I go ahead and ask a question directly? I put it in the chat to John Torres.
If John gets, go ahead and you can put it in the chat. Yeah, send it to John.
I did send it to John. I didn't know if he had it.
Yeah, I got it. I thought you were going to resend it. So Marvin asked, what specific strategies is the county, your department, taking to address the mental health crisis that is upon us here in our country, in our county?
So we are, like a lot of departments and operations, we've had to change how we do business as well. So our priorities have really been around making sure to support our staff who've had to change. Wow, it's September, which means we're going to be on 6 months pretty soon, 5.5 months during this, well, I'm trying not to say extraordinary time. I've changed the pain in the neck time. But, of course, as administrators, our focus too is on supporting our staff through the many changes that they've had to do in terms of their own practice and how they seek out their patients, clients, and just do things in a different way. We are of course monitoring, and some of this data and information that we have, doesn't typically come in real time. I mean, we know approximately, well, we know exactly in terms of our staff, who gets seen in the emergency rooms and mental health crises and things like that. But some of the broader facts and figures actually take some time to compile and have to be vetted through different places and things like that. So, we're trying to keep, and we rely upon our community partners to do this, trying to keep our ears to the ground and, make sure that if there are issues that need to be addressed, that we try to address them both on the higher levels and then, of course, in our treatment clinics, which are still operating. So, just trying to be as flexible as we can, and yet, we have our core missions of serving those that may not have anywhere else to go to get their behavioral health care. And so trying to stay focused and sharp on those things.
All right. I want to encourage everyone to, if you have continued questions, you can either email me at Mike@City Ministry Network, and I will get those questions to Dr. Mora. Or if you have, I'm assuming they can email you directly if they have questions. They find you through the BHRS website.
Yeah, let me type my email here.
Do we have time for one more question, Mike? I have one from Tony.
Okay.
Tony asked, we are hearing mental health issues and concerns are on the rise in our community. Is this sensational or accurate? If accurate, how has service delivery been adjusted for this, and what specifically is on the rise?
Okay, I think I heard the question. The question was basically, how has service delivery been altered? It's mainly been the method or the mode of doing it. There's much more distance or telehealth being done, even in the emergency rooms, where typically our crisis clinicians would go to the emergency rooms to do evaluations. They are still doing that and will do it when necessary, but they're also able now to do it remotely. And so, that's a change. I would say the amount of service, hasn't really changed. Our experience in this county, which is similar to other counties, was at the very beginning of the the pandemic, especially with all the lockdowns, there actually was a dip. So, if we say March, April, May, along with the dip in primary care visits, which was estimated to be as much as a third to 2/3, that people were just not making routine doctor visits, 3 months ago, that there also was a decline in just mental health visits in general, and even mental health visits to the emergency room. And it's only been lately that they sort of have gotten back to either the usual levels, or sometimes that they, rise and fall just like they usually do. So there has been some, rise with that. And so, again, the way that's, we've, provided services, again, to be available and, to try to use technology to our advantage, to be able to continue to serve those that need to be served.
Well, thank you. And thank you to Dr. Mora. I heard a couple of things that I'm going to take forward, one of which evaluate where I'm getting those headlines, right? Like that information about what's going on. I probably don't do that as much as I should. And I also thought it was really interesting how he brought out the idea that we avoid quiet, right? That sometimes that is really where all the thoughts and all the feelings and everything comes through. And so for those of you who don't know, I do work in mental health. I'm a marriage and family therapist. And so this topic and these stories, I have people attached, right, when I see the data. And I know that each of you do too, in different ways, in different methods. And so I think about those of us who have been touched by severe mental health issues, maybe our family members, maybe we've lost family members to suicide or friends to suicide. And so for each of us, I think it's important to recognize that this comes very much to home. It's not just clinical ideas that are out there in articles. And so a couple of things that I wanted to point out. Dr. Mora talked a little bit about resilience, and I wanted to share with you that one major resilience factor that most research talks about is faith, right? Is having something deeper that you're connected to helps you continue to find hope. And so as you're looking at where you cling, I've got a few things that I've even said to you before, and I probably have said to anybody who will listen, and I stole them from one of my clinical supervisors, but she said that if you're doing 5 things to take care of yourself well, you're doing pretty good. And those 5 things are: sleep, get good rest, right? Find out what routines get you good rest. Second is nourish your body. That's food and drinking enough water. Moving your body, going for a walk, right? Standing up, sitting down, doing whatever it is that moves your body. Connecting spiritually, right? That resilience factor, and connecting with others. For me, self-care also looks like figuring out how to be very, very, very honest with the safest people. Being honest when I'm a mess, right? My word of the last few weeks, I'm weary, right? And if you talk to my team, they have heard me saying, guys, it's going to get harder. The clients that we serve are getting more intense, right? The families that were doing okay are back in crisis. The people who were starting to pull themselves into a good space are struggling again, right? And so I think recognize that this is a hard time for all of us. And so how do we come together? How do we identify, and how do we make space to be not okay for each other? So a couple of other tips with social media. I actually have taken the apps off of my phone so that I only log into them on my desktop when I intentionally choose to. I'm not just mindlessly scrolling, right? And so making it so that you have to log in, and it's not just a nice click, but you have to actually type in the password, something to log, to kind of make sure, jog your memory that, oh, I got to pay attention to this. But those are a few things that have been helping me. What I can tell you is this is real. We have families that being in the home with only their family for an extended period of time is not simply inconvenient, but is dangerous. We have kids who their safe place was school and they're not able to be there right now, right? We have relationships that have been tense and struggling and now are at a crisis moment because of the increased time and the lack of ability to go out and do things that were normally stress relievers. And so what you need to recognize is that we all need a little extra patience, a little extra grace as we interact with each other, because everyone is kind of in their different spaces with struggle. So hopefully as you leave today, what you recognize is there is hope. There are ways that you can continue to support and nourish your health, your mental health, your physical health. And there are also ways that you can make space for people to share with you when they're not okay too. If you need resources, if you're struggling, please reach out. You can email Mike, you can find me, you can email Dr. Mora, and we'll connect you with resources. And so please reach out if you or somebody you know needs some extra support. So as we go today, that's what I hope you focus on, is how do you keep it simple? How do you make space for others, right? And how do you limit the negative so that you can focus on what brings resilience for you? Hope you all have a great day, and the rest of today is a peace-filled day for you.
All right, let me close this in prayer and then we'll go. Father, thank you for today. Thank you for your grace and mercy to us. Father, we're in a time that does cause stress and does push us in our mental health. And I pray that you would just continue to strengthen us. For those who are in the midst of grief and struggle, I pray for strength and peace. And I pray that you would continue to use us as a community to encourage and strengthen each other. Bless our day. We pray this in Jesus' name. Amen. Love you all. Thanks for joining us today. And again, reach out if there's anything that we can do to be a blessing to you. Have a great day.